Healthcare Leadership Council, and to date most of our activities have been focused around research, also holding key issue briefings to raise awareness of various healthcare issues, and then also conducting a public policy advocacy program. We've produced a number of papers related to the healthcare workforce and healthcare reform that can be found on our website, which I will give you that at the end of the presentation. Where we're coming in on the whole issue of the healthcare workforce concern is that you have to have a sustainable healthcare workforce in order to provide quality healthcare services. And we believe it's in the public's interest to have an adequate supply and distribution of culturally competent healthcare practitioners to meet the needs of the population. And our reason for feeling this way is, one, that it's an economic engine, the healthcare sector. If you look at any of the projections put out by various Department of Labors, in Connecticut, for example, over a 10-year period, 2000-2016, Connecticut DOL predicts that we'll add about 40,000 jobs in the healthcare sector. And also the United States Department of Homeland Security has identified the healthcare sector as part of the nation's critical infrastructure. Okay, next slide. But through our research, we've come up with a couple of things that we're seeing that have a direct impact on the size of the healthcare workforce and its characteristics. One factor on this whole issue of the economy, with the downturn, we've seen a temporary, and I want to stress, temporary easing of the nursing and allied health care workforce issue. We want to make sure that everyone knows, including our state policymakers, that the shortage is far from over. And we've heard a lot of this from some of the schools, the post-secondary institutions, where nurses are having difficulty finding, the job that they thought they were going to get. They're still finding work, but it's the most experienced folks are being retained in the workforce, and it's a little bit tougher for the newer graduates to find some opportunities. Also with demographics, our aging of the population, it's going to have a huge effect when all the boomers start to retire and require more health services. Technology also has a huge impact. If you just want to think about some of the advances that have been made in the field of radiology. Another factor which we find that has an effect on the healthcare workforce is legislative and regulatory issues, as well as the healthcare operating environment. In a recent draft report that we prepared, we have identified over 30 different entities that have some role in Connecticut's healthcare workforce development system. Some of them are very specialized. They could just be relating to, reviewing complaints about specific occupations where people, they're filing a complaint. But still, when you think about that, 30 organizations, that's a lot. Also, we're finding that state and federal healthcare reform efforts are going to have an impact on the size and the shape and the characteristics of our workforce. As more people become insured, the pent-up demand for services will arise, and then I think we're going to have those shortage problems coming again. And also the payment system has an effect on the healthcare operate and on how people choose what kind of professions they're going into. The payment system at this point appears to reward specialty services and also treatment. Like the more you do, the more you get paid. Okay, could we get flipped to the next slide? Some of the factors and common themes that we've seen of the past studies that we've reviewed, there's a number of impediments that are related to individuals, institutional factors, and systemic factors. Okay, next slide. Concerning the individual factors, a lot of there's been a lot of consistency in, the same recurrent themes. One, lack of awareness of opportunities in the healthcare sector, of different types of jobs that might be available. Also, some individuals who may want to get into the healthcare arena, they do not have a GED or a high school diploma. Remedial education and English as a second language, we're finding this to be a huge issue. Cost of education and high student indebtedness is also steering many people to more specialty occupations where they can make more money. And then also there's the whole issue of work, life, and school conflicts. The next chart, I just wanted to show some of the things that we found if you look at the talent pipeline, and it's throughout this whole system that if you look at early childhood, we know that that is a wonderful effort that is needed to make people ready for school, for kindergarten, and that kids who've had a pre-K experience do much better in school. Looking at our K-12 education system, I put some statistics down there from the latest CAPT and CMT scores. And what's a little scary is if you start looking at the figures for the fourth graders that have scored above our state goal in mathematics and in reading, the literature that we've come across saying that if a kid can't read by the end of third grade, they're going to have a really tough time for the rest of their career in school. So I wanted to just point that out, and we're seeing it that people are kicking the can down the street because it's showing up in the post-secondary education system where a lot of the students are needing remediation in either math or English, both in community college as well as in four-year institution. That's a real problem because the studies will tell you that those folks who are having a tough time with having to take remedial education, that they're not likely to graduate within the time frame that one would hope. Okay, you flip to the next slide. Okay, some of the institutional factors that we've identified through all the previous studies, again, we hear this about faculty salaries in the public allied health excuse me, academic settings aren't competitive with the private sector. Also, there's been issues about clinical placements and a cumbersome approval process between the sites and the post-secondary institutions. Also, we've seen another issue is data on the number of persons who are waitlisted in various different courses. It's just not routinely collected and reported. And also an inadequate deployment of technology, which could be either, not having a lot of courses online that you could do that way, the use of simulation, use of online clinical placement scheduling, and things like that. And I know that Alice will probably talk about some of the studies that the policy board has funded that relate to some of those issues. Think of the next slide. The other issue we want to look more system-wide is that we essentially see that there is a lack of a centralized healthcare workforce database. It is just, there's a lot of data out there. It's not combined or linked together. And it's a real problem for those who need to do planning for healthcare positions. Also, the other issue that we've seen is that there's no coherent statewide healthcare workforce plan that identifies specific operating needs of all the institutions, the capital needs, There's no specific targets that are set up for each occupation, and basically no one's accountable for meeting any goals. Also related to this issue is the career ladders and lattices, and as Alice can tell you, that there are some professions where the gaps are just too large or they don't exist, and the confusion over the articulation agreements. What I wanted to do is just kind of go to the next slide and show you some examples of where we're seeing some of the issues more in a graphic presentation that highlights some of the problems. In the oral health pathway, you'll see that the gap between a dental hygienist and going to a dentist is just huge, and that if we're trying to create opportunities for people to move through the process and gradually attain higher skills, that's a barrier. That's not a realistic pathway. Another thing that we've discovered in going through the different training providers' catalogs is that some institutions are providing certificate programs for credit, and some are not for credit. And we're not really too sure what that means and how that has been determined about whether or not, a community college is going to offer something as credit versus non-credit. So I hope we can get some discussion about that later on. And also what we've come across, we can go to the next slide. We've tried to map out administrative healthcare career pathways, and you'll see, in looking from this chart, that there are pathways there, but it's very difficult to understand what the difference is between medical coding and billing specialist as opposed to a health care claims processing person or a medical insurance specialist. We've taken these titles of the certificate programs directly out of the college catalogs. And additionally, you'll note that some work or some certificates are for credit and some not for credit. So it's going to be extremely difficult for high school graduate trying to pick out, what they want to do to understand how to navigate that system. Let's see, if we go to the next slide. What we've also hoped to do is identify some promising practices in other states, and one that we feel very strongly about is creating a healthcare workforce database. We've got to get, there's a ton of information out there, but it is just not linked. Other states have found a way to address that issue, and I've provided some websites there where people can look to see what other states are doing. The other practice is developing the healthcare workforce strategic plan, and we have to come up with some annual targets for various occupations to determine, that we can measure our progress, and also start to identify career paths and articulation agreements that need to be developed. We looked at a study in California, a career ladder effort, and it was really interesting to try and take what they mapped out as career pathways and to see how that worked in Connecticut. And then when you start getting into the weeds a little bit, it's very, very hard to figure out what courses you need to take that will help you in the long run and not end up costing you more in the long term. Okay, if we could go to the next slide. I know that the Allied Health Policy Board had conducted a clinical placement study, and we also looked at the issue of online clinical placements, and we really think that there's a wonderful opportunity here to use technology and to help with the scheduling of courses and clinicals. Okay, and the next slide. Another is this whole issue of transferring. How does coursework in one place apply or not apply to another institution? Will it transfer? And Connecticut's does not really have a system that it's very transparent. You have to really search to find out whether or not a course taken at one college will transfer over to another system. So what we wanted to do was just point out some areas. California has a program called Assist, and the slide before that was the New Jersey transfer. Okay, we can go to the next slide. Okay, the use of patient simulators, again, this kind of relates to the whole issue of the clinical placements, and perhaps there's a way of using simulation to supplement the whole issue of clinical placements. And we have not yet come across any state of Connecticut plan that identifies, you know, the use of simulation and how it's deployed in the state, as well as, you know, are there opportunities to go after for additional funding to work on this or other collaborations. Next slide. On distance learning, we came across the Connecticut Virtual High School. This is really a wonderful site that really needs to be marketed to a greater extent, providing help someone get a GED or a high school diploma. And also trying to expand the capacity of nursing and allied health distance learning courses. We think that we could probably do a little bit more. Next slide. Health careers. Another promising practice. This site is one of my favorites. I think what we need to do is really kind of start linking the information on health careers. This provides a really good foundation, but we need to identify the pathways, the training providers, the articulation agreements, and supply and demand forecasts in one place. And I'm sure that the technology people in this area could be very helpful in that. Next slide. Okay, this is just basically what I was talking about, you know, putting this information together. And this is also what we've seen in other states where they keep talking about trying to build the awareness that we need to start linking information so that people don't have to go searching and get frustrated. So next slide. Another thought was a high school summer health career camp. And we know that some of the AHACs have some programs that are offered during the summer. We think that it might be worthwhile to do a pilot where you have a 6-week paid summer program, and as part of that program for the summer, this would be for high school kids, that they would learn job readiness skills and leadership skills. They'd also receive some credentials, for example, on how to take vital signs and be certified in first aid CPR. And also to assess the kids for any academic deficiencies so that we can develop an individualized academic improvement plan so that remediation occurs while the student is still in high school. And that we know that there's a lot of really good work going on at Housatonic Community College and also up in Danbury. Some really interesting work's being done. So we thought that this might be a proposal that the group might want to consider. And then also it would also have the job shadowing for multiple healthcare professions that a student could come, you know, do that. Nurse residency program. From some of the research that we've come across, newly licensed RNs, you know, they're not as prepared as they should be. And so what we're suggesting is that maybe we could offer like nurse residency programs. I know that Margaret Flinter's group has that, and it just seems to make sense that there's an existing program, and why not try to use that. Next slide. Okay, here's one that I also thought was kind of interesting, that why not put information on open faculty jobs? There's 2 examples of this. This one is the Bay Area in California. If you want to go to the next one. This is the Massachusetts Nursing Center. And it's very interesting to go through and see how people are trying to, organize information and get more faculty. Florida, that's the next slide, also has a center for best practices, which I'm sure that something like that could be created here in Connecticut. And Boston has a Welcome Back Center for immigrants to help those who have foreign health care experience gain employment in the U.S. And I'll take questions, whatever you want.
Great. Well, I think we'll go now to Alice, if that's good. Hold on while I get Alice's up here. There we go.
Oh.
There you go.
Great, thank you. And I think I'll be able to go through some of my slides rather quickly because Tanya and I are talking about some of the same issues, and I imagine that most of the people on the call are pretty familiar with these issues as well. But I'm happy to present today on behalf of the Connecticut Allied Health Workforce Policy Board. And for those of you who are not familiar with us, we were established in, I'm sorry, Ellen, you can go to the next slide. We were established in 2004 in a public act, and with the purpose of conducting research and planning activities related to the workforce. Like every other group, it appears that the legislature has created different definitions for allied health, and in our case, allied health was actually written out rather specifically to include professionals or paraprofessionals who are qualified by special training, education, skills, and experience in providing health care in collaboration with a licensed professional. So though it's not an exhaustive list, it included physician's assistants, registered nurses, licensed practical nurses, certified nurse assistants, home health aides, technologists and technicians, and medical therapists, among others. I'm sorry, go back one, Ellen.
Sure.
Our key responsibilities, and this is just a few of them, but largely center around monitoring data and trends and examining existing programs and making recommendations around educational programming, curriculum, recruitment, and retention strategies. Every year, the Allied Health Workforce Policy Board, based on that kind of analysis, issues an annual legislative report, and it looks at activities already going on in the state, as well as recommendations for legislative consideration, and that's most of what I'll spend the time I have today talking about. Ellen, you can go to the next slide. Again, I think we've covered this, and I'm sure you've covered it before, but despite the fact that we have a recession and a tight employment market, even in healthcare, we do expect to see significant increases in jobs over the next several years, looking at Department of Labor data. And so even though, as Tanya said, we've heard things like, newly graduating RNs are having difficulty finding jobs, we know that there's still expected to be a 17% increase over the 10-year period for RNs, just as an example. So we do still expect this industry to be a significant player in our economy. The next slide also just speaks to the fact that even if beyond the Department of Labor data, in recent surveys done by the Connecticut Hospital Association, they're still finding vacancies in a long list of employees, though these are lower than they've been in the past 10 years. They are all in the single digits rather than the double digits as they had been in the past. But we still have a nursing shortage. For instance, they have a 3.4% vacancy rate for RNs at their member hospitals. And though that sounds quite low, it's 373 open positions. So, again, I think it just shows that this is a set of jobs that is going to be clearly needed in the future as well as today. So, again, I think the more seasoned professional is finding an easier time of finding employment. I just wanted to mention in the next two slides, or next several slides, we at the Allied Health Workforce Policy Board commissioned 2 studies because of the ongoing concern that sufficient faculty and clinical placement opportunities were going to impact our ability to provide a healthcare workforce. And so, Ellen, if you'll switch to the next slide, I can make these reports available on the Sustanet website, but just to give you a couple of ideas, when the faculty staffing plan was done in 2007, it showed that we had shortages in 15 of 34 identified career areas. And you'll actually see, if don't flip back, Ellen, but if you were to flip back in your slides, you would see that many of the ones that are on this list are also in that growing demand list. For instance, health information and medical records technician, cardiovascular therapist. Those are occupations that are going to see increased demand, and yet, according to the study we did in 2007, those were already programs where we were showing shortages because of not having enough faculty to expand programming. If you go to the next slide, there are also some areas, and this is just a few, where we were at the time overproducing. And but I just want to have a caveat that we haven't re-looked at these numbers to see if that is still the case today. But for instance, we often produce we have an overproduction of nursing assistants. But part of the reason that there are still openings is because there's a lot of churning in that particular industry. Physical therapists, we have been overproducing at a lower educational level than is now required. As many of you may know, the physical therapy assistant is physical therapist is moving towards the doctoral level, where we would have an underproduction, of course, of those students. So we had both good and bad. And if you go to the next slide, there were 2 areas probably of the most concern. And I'd like to just spend a minute talking about this because I think the data is hurting us on a policy level at the moment. But when you looked at the licensed practical nurse, for instance, they appeared to produce an adequate supply of professionals on an 18-month rather than a 12-month cycle. Again, you all may be familiar, the licensed practical nurse program is an 18-month program, but Department of Labor data has a 12-month snapshot of annual openings. And so some studies that have looked at it, unfortunately, have said that they're overproducing licensed practical nurses because they look at 1 year where there are graduates. They don't tend to look at either the year before or after where there are no graduates, and therefore show an oversupply when in fact we have an adequate supply over a 2-year period rather than a 1-year period. So that has been some of the problem, I think, in the discussions we've been having at the legislature about the fact that we have enough nurses and we don't need the licensed practical nurse program. On the registered nurse side, when we put this study out, it created a lot of concerns, I think, particularly in the nursing community, that if you line up what the Department of Labor says you need on an annual basis in terms of supply and the number of graduates in programs, it appeared to match. And people were very concerned that that would tell people that we had we met the goal and we could back off now. And in fact, we argued that you cannot back off of the need for production of RNs because we've had such a gap over time. And also because we do know, once the economy is better, that people will, in fact, retire from these positions, go back to part-time positions, et cetera, and that we'll need to continue a high level of production of RNs, which is at about 1,100 a year. So that's what the faculty staffing plan said. And then, Ellen, if you go to the next slide, we also were concerned about the opportunity for clinical placements and whether it had an impact on the availability of sites for students and whether that was limiting the number of students who could be enrolled in programs. And so we asked the Connecticut Hospital Association to do a study to see what the situation was, and these were their findings. First was that it was clear that we are exhausting some opportunities in clinical specialties, and that to a small extent we have just some distribution issues around clinical placements. And what I mean by that is that it appears that every single school needs to do maternity in the same semester. If there was a way in which that could happen differently, then we could we could manage, but the way that it's kind of scheduled now, it creates a particular problem in a particular semester. They also, one of the other issues that they found in the study was that there seems to be days of the week that schools really like to use for clinical placements and days they don't. So if they don't make full use of a full week, they end up with a distribution issue as well. So some of those things came to light in the study. And the other was that it was really clear that clinical sites are protected by schools. They love their sites. They love to be able to get the students into those sites, and that match is very important. And though there might be other opportunities for clinical sites, if the school doesn't feel it's the perfect match, they may not make use of it. Okay, Ellen. And again, I think I'll skip over these, but it basically just tells you that it appeared for the most part that there was sufficient clinical opportunities for both RNs, and if you do the next page, same thing held true for LPNs, though we'll say that because of the pressure on acute settings for nursing placements, the LPN who isn't likely to be hired in a acute hospital was getting pushed out a little bit. And then the last slide on this particular issue just says that, you know, there are still some barriers, clinical opportunities, that school choice issue that I mentioned. There's still a lack, obviously, of faculty, staff, preceptors, and space, which limits how many students a particular facility can manage. And then also, which we've highlighted in some past reports, is that the contracting process in particular is just awful. On both the kind of school and the hospital side, and with the intervention of the state AG's office, they often find it very difficult to get contracts through the process and students placed. So those are all issues that ultimately do affect the opportunity for clinical placements. But I really wanted to spend the majority of my time sharing with you what we have just released as our 2010 legislative recommendations. As many of you know, our state budget is in a terrible spot, and so we don't expect necessarily to be able to get these issues through, but we continue to raise them as critically important as we move forward as a state, and hope that when resources are available, that they get targeted to these types of programs and interventions. The first recommendation is one that Tanya spoke to as well, which is that we really do need a state strategic healthcare workforce plan. We need to identify the gaps in supply and demand and the capacity of our state's education institutions and providers to meet that need. We need to look at the barriers to career advancement, and again, Tanya mentioned some of those. There are huge gaps in the career ladders themselves, as well as personal and financial barriers that individuals will have to trying to advance in the healthcare workforce. We have quite a few people at the bottom of the ladder and very few ways to move them up effectively. And then also this plan obviously should build on things that have happened. The hospital task force, which happened, I guess, 2 legislative sessions ago now, it feels like, and certainly the work that's happening under this board. Tanya did mention data, and I think that that's a key piece of what's needed in this plan, and we're very hopeful that the work that the Department of Public Health has been making of their online licensure database will eventually put us in a position to look at many of these occupations, though it's not everything. We're very excited about the fact that they've made progress in moving from a paper system to a database that's going to allow us to track particularly the nursing field. I don't know how many more times we can raise this issue. I think we've raised it in every report we've issued since 2006, but it's clear in everything that we look at that there are not enough resources in our state's educational institutions to promote student success. When you look at the number of students who are there, the number of counselors are not adequate. They need career advisement. They need personal supports as well, and those pieces of student success plan really need to be built into the budgets, and that's just something that eventually we've got to make some headway on. And also that the second bullet on this page is about the fact that many people will come back to or come to college for the first time and take a course at a time or take a non-credit certificate program, neither of which would be eligible for financial aid. We do have the flexibility with our state financial aid to allow students to take one class at a time or to pursue non-credit programs that are in demand in our state, and I think that's something that the legislature should authorize. The next slide speaks to many of the things that Tanya talked about at the end about the importance of some coordinated statewide outreach campaign, and we identify in the Allied Health Report, AHEC, the Nursing Career Center, one-stop centers, and secondary and post-secondary institutions as key stakeholders in that campaign, and believe that some of that might be able to happen without additional resources if those groups were brought together, but ultimately we do need some of the things that were outlined in Tanya's presentation, whether it's websites, the ability to produce the Hot Jobs Guide, which is a fabulous resource, and instead of always scrambling for those, we should have it as part of a plan. Next recommendation is about investing in faculty. The faculty plan that we commissioned made it really clear that if programs already weren't vulnerable because they didn't have enough faculty, they were likely to be vulnerable. There are a number of programs that are led by literally 1 or 2 faculty members who could retire at any time, and those programs would shut down. So there's a great need for shoring up the state's faculty in nursing and allied health, and we need a plan for that as well. And one strategy that's recommended and has been for a number of years is a scholarship for service model, which is based on the concept of ROTC and others, where people give time in lieu of scholarship money that's been given to them, and that's one of the suggestions that's been put forward. I do want to clarify that we have always put in a scholarship for service model, recognizing that people need the money on the front end, that if people are working, if they're going to be ineligible for financial aid, potential aid, they need a scholarship rather than loan forgiveness. There seems to be a lot of interest right now in loan forgiveness, which is not necessarily bad for them, but the person has more than likely never been able to get started because they needed the scholarship up front. And given that many, many people from our state colleges and universities stay in Connecticut, I think the scholarship for service model could work here. The 5th recommendation is about expanding existing programs and shoring them up, and again, you can read this for yourself, but it's clear that we have still a good bit of demand and expect long-term demand in healthcare fields, and have some areas that are underproducing because of the need to expand, and so that's what this recommendation speaks to. I would say, again, as a side note, the governor's mitigation budget that removed, or I'm not sure what the right verb is, but the licensed practical nurse program being gone is a major issue. We've at least decreased our ability to produce LPNs by half by eliminating that program, and have in fact eliminated the only publicly funded program in the state. So that's the kind of thing we would not want to see happening. If we're not doing expansion, hopefully we would at least not be cutting, and that's what the second bullet on here says too, is that we need to maintain existing spending in our colleges and universities, not to cut it, and the LPN program at the technical high school would fall into that category as well. And then we just have one more recommendation, which is that we support employer-sponsored training. There's been a lot of really great projects going on in our state, many of them supported by the workforce investment boards, that have worked with employers to identify what their needs are for their current workforce, as well as potential new employees, and designing programs that meet their needs. They have used a lot of technology. They've used a lot of best practices to put those programs in place, and there's no state money currently that's really supporting those programs, and that's something that we'd like to see more of. And also the Summer Youth Employment Program has had a lot of paid summer jobs for students in healthcare, and currently that is also not in the governor's budget, but is something that we found in the past to be a great program and helpful for getting students in the pipeline as was suggested. So that's it for the Allied Health Workforce Policy Board recommendations.
Great. Sal Luciano has a question, which I'm going to pull out so I can read. Oh, and Pat Carroll as well. Sal's question, well, it sounds like you touched on it, but you might want to talk about this more. The governor closed a pathway for nurses in the community colleges. Given your findings, wouldn't we want to urge her to keep this program open? And Pat's question is, where do we stand with the closing of LPN programs at state technical schools?
So this is Alice. Sal, I think that you're referring to the closure, which is actually at the technical high school system, not at the community college. But the governor did, in her mitigation plan, which she had the authority to do without legislative approval, she effectively closed the LPN programs at the technical high school program, which was an adult program, post-secondary program. And so they graduated for the most part, graduated their last class in January of this year, and are effectively closed. They have some, I believe, part-time programs that are still wrapping up this spring. But from what I understand, it has not been restored. Though there are at least 2 bills that have been raised. One is being heard this week in the Labor Committee that would reinstate the program as a part-time program, though with the same ticket money that funded the full-time program, so I'm not sure if there's some confusion there. And then there was also another bill raised, I believe, by Representative O'Brien that has not been slated for public hearing yet, as far as I know. But yes, I think there is some misunderstanding about the need for LPNs, and again, the Connecticut Vocational Technical System just graduated 345 students. If you take them out of the mix, we will have an underproduction at least by half of those needed on a 2-year basis. So I believe that the program needs to be restored, possibly, not as many sites or maybe not even as many students in this down cycle in the state budget, but certainly should not have been eliminated.
Can I just add something too on that about the elimination of the LPN program? Is that also served as a way of those students who were LPNs could go into the second year of an RN program. So it provided a very nice pathway for folks to enter into a higher level of training.
Yes, I mean, not to belabor the point, but the technical high school system had just gone through a process with the community colleges and Charter Oak State College with Career Ladder resources, they had worked on an assessment of their curriculum, had upgraded the curriculum so that it matched up more closely with the community college program so that they could make that seamless transition into an RN program. So so much work had been done to get that program really shaped up to be the asset that you're talking about. It's a shame to see it on the chopping block.
I'm going to actually unmute Sal and Pat and see if they have any other questions. I don't see any other questions. Sal and Pat, are you there? Oh, maybe they muted themselves. But it looks like that's all we have for questions. So I want to thank you very much. Again, the video and the slides of this webinar will be up online soon, and we have another one coming up on Thursday, the 25th, at 3 o'clock with the Department of Public Health. So thank you all very, very much.
Thank you.
Thank you. Bye.